What does this theory says? This theory says that the all the teeth erupt in the balance, and the teeth are in the equilibrium phase between the labial and the lingual aspect. The teeth are in the balance. So the pressure from the labial aspect and the pressure from the lingual aspect, the pressure remain the same. Here you can see, by changing the pressure here in this particular patient, due to the infection, you can see the lip has been destroyed. So the teeth has moved because the pressure from the labial aspect has changed and decreased, and the pressure from the lingual aspect, because of the increased pressure on the lingual aspect, the teeth had drifted toward the side of the least pressure. In this situation, the reverse you can see over here, due to the scarring, the teeth have moved toward the lingual aspect. How does this habit affect on the teeth? By changing the pressure. As you know, the teeth are in the equilibrium phase in the labial and the lingual aspect. By having the habit, different kind of habit like thumb sucking, like tongue thrusting or mouth breathing, the equilibrium basically changes. So by the change of the equilibrium, due to certain habit, you would be observing and having a different change in the position of the teeth, and they start moving according to the soft tissue pressures. So basically, what does the habit do? They change the equilibrium and they change the soft tissue pressure that are going to be applied on the dentition. So that's how they impact. For any given habit, the three most important thing that has to be considered is the intensity. How intense is that particular habit, and what is the duration? The duration is a very important aspect of the of any habit, because from the biology of the orthodontic tooth movement, you know that for any biological tooth movement, for the activation of the osteoclast and osteoblast, you have to have secondary messengers. In order to have the activation of the secondary messenger, these forces has to be remained for certain duration and certain period of the time. If the duration of the forces are less, they won't be able to generate and activate the secondary messenger. So osteoblast and osteoclast, that would be leading to resorption of the bone on one aspect and deposition on the other aspect. That is mediated through the biological activity. And in order to generate and initiate the certain biological activity, you have to have certain duration of that particular habit, no matter how intense it is. Intensity matter when the secondary messenger activate. So three most important thing that should be considered for any habit is the intensity, is the duration, and is the frequency. How frequent is that particular habit? So in this particular duration, in order to activate the secondary messengers, you have to have around 4 to 6 hours of particular habit. But this 4 to 6 hours is very common, especially if a child or anyone is practicing that particular habit while during sleeping. If during the sleep he's having thumb in the hand or finger in the mouth or any particular kind of habit, 6 hour or it's not an issue. Moving on to the different kind of habit, we have the most important habit are the thumb sucking or finger sucking, uh, is the tongue thrusting as a result of the thumb sucking as well, and mouth breathing. These are the three more important topics we'll discuss in detail in these topics. And there are certain other habits that are minor. For example, the bruxism, nail biting, we will talk about this in as well. The thumb sucking is a very common habit, as you can see that, and it can be defined as placement of the thumb or any finger in the varying depth into the mouth. So the depth varies among different individuals, and this is pretty common in the childhood, in the preschool phase, when then the child is not going into the schools. So this is pretty much common. As you can see, this is up to 23 to 46% of the of the children up to 4 years. And the seriousness of of the habit become greater when the permanent teeth are erupting. So what comes in your mind? If the lower incisor is erupting, if the upper incisor is erupting, and the child is keeping a thumb in the oral cavity, what would happen? This will definitely be stop erupting the incisors, or it would change the position of the dental lower segment. However, if for example, if the lower incisor erupt at the age of 6 or upper incisor erupt at the age of 7, this habit should be eliminated even 1 or 2 years before the eruption of this, because this habit has to be eliminated before the eruption of the permanent teeth. So after the preschool phase, this habit should be eliminated. Otherwise, it will lead to the stoppage and would produce different kind of the features. So, before diving into the details and the features of the of the thumb sucking, the thumb sucking is a signature mark that the child is not getting enough attention from the home and from the mother. This is this is a sign of psychological disturbances. So before starting this treatment, you have to look into this matter and engage the parents for this particular aspect. Moving on, the management. uh, when the child places the thumb or any digit into the oral cavity, the open bite and asymmetry and all the effect which will be imparted on the dentition, that would be according to the position and placement of the thumb. For example, what I mean to say, if the child thumb the suck in a symmetrical way, so what you would be observing, you would be observing a symmetrical open bite. If the child is practicing the thumb sucking or finger sucking habit in this particular direction, then definitely you would be observing a kind of situation in which you'll be having the asymmetric open bite. So asymmetric open bite is a key feature and a very diagnostic feature of the thumb sucking. However, you can judge and diagnose the thumb sucking by checking the fingers as well. So in a patient of the thumb sucking, as you know, this habit would impart will start producing impact when it's more than 6 hours. So the parents and the siblings would be able to tell you and would be able to brief you about the history of this habit. Secondly, you would be observing a very neat and clean thumb and the fingers as compared to the rest of the fingers. They would be very clean. And the secondly, you would be observing certain intraoral features. So coming to the intraoral features will depend upon how does the pressure is being imparted on different part of the tissue and according to the depth. For example, you may have a situation in which the thumb is placed in this particular direction, like this, and you may have the placement of the thumb deep up to the throat. So the impact of this habit will be guided by the position and placement of the finger and the thumbs. So as you can see in this picture, you see there is a pressure on the upper incisors and they are getting flared. Okay, because the pressure is from the palatal aspect and the upper incisors is getting flared and it is moving labially. Okay, this is one thing. Secondly, if this habit is during the 7th year of the life of the dental age, this will stop erupting the incisors. Common sense. In a similar way, as you see, the placement of the thumb is in a way that there is a pressure from the labial aspect toward the lingual side. So you would be observing the retroclination of the lower incisors and the proclination of the upper incisors. Okay, the upper incisors would get proclined, the lower incisors would get retroclined. So what would happen when the upper incisors are uh, proclining and the lower incisors are retroclining? So what would happen? The overjet will increase. So far we know 3 point. The upper incisors would procline, the lower incisors would get retrocline, the overjet will be increased. Okay, so what would happen on the overbite? For the overbite, you know, the upper incisors are flaring. So with the flaring of the upper incisors, you see the overbite is decreasing. So for a given situation, if the upper incisors are proclining and the lower incisors are retroclining, so this is increasing the overjet on one aspect and this is decreasing the overbite. How is decreasing the overbite? Because with the proclination, you see the amount of the overlap of the upper incisors over the lower teeth is decreasing. You have a situation over here, and with the proclination of the upper incisors, the amount of the overlap of the upper incisors on the lower teeth is decreasing. So what is happening with the habit of the thumb sucking? You have the proclination of the upper incisors, you have the retroclination of the lower incisors, you have increased overjet. The overjet is increasing, and because of the proclination and because of the retroclination and hindrance and the stoppage of the eruption of upper and lower incisors, the overbite is increasing. If the overbite is not increasing, because thumbs in the patient of the thumb sucking, the presence of the anterior open bite is a key signs of the habit. So you have proclination of the upper incisor, retroclination of the lower incisors, increase in overjet, decrease in overbite. So what would happen on the posterior teeth? As you said, the placement will determine the effect if it is posteriorly positioned. And because of the sucking, you can practice it with yourself. If you suck the thumb, you will feel the buccinator or the buccal forces will start increasing forces. For example, if I place my tongue over there and if I suck anything, yes, you see my pressure on the cheek is increased, and because of the increased pressure from the cheeks, I will be observing the palatal crossbite. So the crossbite would be increased with the uh, with the thumb sucking habit. And in a similar way, the posterior teeth will start extruding. Okay, if you see have the pressure like this, then the posterior teeth will start extruding, as you can see over here. With the thumb sucking, the buccal pressure would increase, and this will lead to the crossbite, and this is basically the buccal crossbite in where the lower teeth are buccal. Okay, so moving on. So how does the habit will produce crossbite? Because it will change the equilibrium balance. How it is going to change the equilibrium balance? The tongue will go lower down, and the having the thumb in the oral cavity, and having the sucking, what would happen? The intraoral pressure is increased, and the pressure from the buccal expect by the buccal musculature is increased. That is leading to development of the posterior crossbite and changing the equilibrium. So what I said, how does the habit destroy and ruin the dentition and the aesthetics and face? By changing the equilibrium. One sentence: habit change the equilibrium, and uh, the face develop according to the changed equilibrium. Moving on, so what would be the effect I discussed in detail? There's a lifting of the upper incisor, right? The proclination of the incisor, the retroclination of the lower teeth, increase in the overjet, anterior open bite due to the restriction of the incisor eruption, as well as the supra eruption of the posterior teeth. You know, because of the pressure is increasing in the oral cavity. Because when I'm having increased pressure by having the thumb in my mouth, this will lead to the increase. The increased pressure will lead to the extrusion and overdevelopment of the posterior teeth in the vertical dimension, and in the transverse dimension is the upper arch will be constricting. So this will lead to the situation less like this. You have increased facial height because of the supraeruption of the posterior teeth. You have proclination of the incisors. You can see the retroclination of the incisors and anterior open bite. That is the hallmark of the. So how does we stop the habit? For this stoppage of the habit, as I said in the start, this is a signature mark of the some psychological disturbance in the preschool phase. So you have to address the patient and start dealing the child as an adult. So we have basically three different approaches for the management of the thumb sucking a patient. One is the adult approach. Adult approach means that you are considering the child as an adult, and considering him as an adult, you would be convincing the child for stoppage of the habit. So until and unless the child is not convinced for the stoppage of the habit, you will not be able to stop the child. For example, the function and the major purpose of the appliances, intraoral appliances and other gadgets, are just to remind the child that he has to stop the habit. It is not to punish the child, or it's not to irritate the child. So you start the treatment with the adult approach. Adult approach means you will be considering the child as an adult, and considering him as an adult, you would be convinced him first to stoppage of the habit. And once the child start practicing your advices and stop the habit, you will be rewarding him. So the approaches is, the first is the adult approach, the second is the reward approach. You will be rewarding the child for the stoppage of the habit, that is by the positive reinforcement. So and then you will be practicing by the reminder therapy. Reminder therapy means that you will be assisting the child by certain reminder. So how you can remind the child? By some extra oral gadget, by adjunctive therapy. Adjunctive therapy means that you may cover the hand by some gloves, by some socks, by some certain things, or you may place some chemical agents like anything very bitter. So when the child places the thumb in the mouth, something is very awkward at the taste, the child will bring the thumb out of the oral cavity. In a similar way, you can place anything else like a plaster, or you can tie with the dupatta. So the basic strategy and philosophy of the all kind of intraoral appliances is they act just as a reminder, as an additive effect to the basic strategy of treatment, which is basically the convincing the patient and the child for the elimination of the habit. So you could have different kind of the appliances. The cord helix is the one of the appliances, as you are aware of this, that the most of the cases who practice the habit of the uh, thumb sucking has the posterior cross bite. So one of the treatment strategy in this particular age group is the expansion, and we can use the cord helix because with the cord helix you can do the expansion, and the design of the cord helix is just like this, that the anterior helices could be acting as an additive effect, and they can act as a reminder to the child for the elimination of the habit. When the child will place the thumb in the mouth, the anterior helices will remind the child to stop the habit. Will do expansion, and they can act as an intraoral appliance that acts as a reminder. You can have bluegrass appliance. Bluegrass appliance is purely meant for elimination of the habit. They do not have the element of the expansion. The design of the bluegrass appliance is just like they have the bead, which is in the wire, and the child can rotate with the tongue. So they stop the habit and forget about the habit of thumb sucking. They can engage with some other activity, and the activity is the rotation of this bead with the help of the tongue intraorally. However, when the child would place the thumb in the oral cavity, this appliance would again act as a reminder to stoppage of the habit. So this is how it is constructed. The for first of all, the band are selected, and this bead which is being rotated inside the wire is inserted into the wire, and this wire is soldered with the band. Now we have the third category is the palatal grip. This is much more aggressive as compared to the bluegrass appliance. Big breaker, the appliance would remain in the oral cavity even after the elimination of the habit. So they act as a kind of a retainer, so that the child could not restart the habit again. This is much more aggressive, and how it is constructed. This is the bands, and this palatal grip is soldered obviously extraorally, and this is cemented. After the soldering, this whole appliance is inserted. So when the child placed the thumb here, this would act as a reminder. Then you can have the removable appliances as well. This is a classical removable appliance that the child can remove, and you could have a crib like structure over there, so that when the child placed the thumb, this anterior crib act as a reminder. Outcome of the removable appliance is completely dependent upon the wear of the appliance. The patient or the child should be wearing the appliance in order to produce the result.